Hi, my name is Jamie Riddell. I'm a neonatal nurse practitioner with Seattle Children's Hospital, and I've been working here at Providence since 1996. I started as a LPN and just worked my way up through the ranks. So I've done everything from LPN to RN to nurse practitioner. I understand that education really helps us do a better job, and so we really want to talk today about the late preterm policy. One of the next topics we're going to talk about is hypothermia, and this one is, I would say, one of the most common complications of the late preterm infant. Late preterm infants, although they may be the size of a term baby, don't often have the adipose tissue just because they are preterm. So adipose tissue provides them with the insulative layer to help them stay warm. It also is the brown fat that they burn. If they're not taking in enough oral feedings, they break down their brown fat and use that as glucose supply for their bodies. In order to stay warm, the baby needs a constant supply of glucose, and so oftentimes hypoglycemia and hypothermia go hand in hand. Some of the ways to best prevent the baby from becoming hypothermic, as we discussed previously, is keeping the baby in skin to skin as much as possible. When the baby's not in skin to skin, it's important to have a double blanket layer. Really teach those families how to wrap the baby up. As we all know, sometimes we go into a room and there's been lots of family members and the baby's just kind of unwrapped and essentially open to the elements. So just making sure that families understand it's really important to keep that baby swaddled nice and tightly, and to keep a hat on the baby anytime it's not in skin to skin. Babies also cannot generate heat as well as term babies can because of that adipose tissue layer. So some ways to decrease heat loss and maintain normal temperatures in the baby are to maintain a neutral thermal environment. That might mean that the temperature in the room is turned up a little bit if it's in the winter. Make sure that the baby's not near a window or the vents. Make sure the baby is kept swaddled. Some other things that you can make sure that you're doing is partial baths as opposed to full baths. Make sure that if you might even delay the bath for a long period of time, you might only wash the hair to start with. Just making sure that the baby is stable before you give it a bath. Again, I would never give a baby a bath who's already struggling. So if you're having trouble maintaining temperatures, if you have lower glucose levels, if the baby's a little tachypnic, or the baby has had any kind of complications, we would want to delay that bath for a period of time. You can also make sure that when you're weighing the baby after they've had their first breastfeeding, that you're using warmed blankets on the scale, that it's a very short and quick weight. Put the baby back in skin to skin as much as possible, and utilize the skin to skin as much as you can to stabilize those temperatures, especially in the first 24 hours of life. You're really going to have the most trouble with hypothermia in the first 6 to 8 hours, but in general, the first 24 hours is really important to make sure that you've established normal temperatures and that their sugars are staying up, because those two are so interchanged. The other thing to be aware of is that a cold mom is going to make a cold baby. So if you're having trouble maintaining temperatures in the baby and it's been in a skin to skin, get a temperature on the mom. Maybe she's not the warmest person. And you might need to add some additional warm blankets or help warm her up before baby goes into skin to skin.